Okay. So we continue talking, really, yeah, okay. We continue talking about the different requirements for microbial growth. And we're going to discuss the temperature requirements. Turns out microbes grow in different habitats. Microbes that are called psychrophiles actually grow in the cold. Last semester we had a wonderful psychrophile growing in the fridge. We put some plates in the fridge and then didn't touch them for a couple of weeks. It was absolutely accidental. And pull them out and there's a little pink grow on there. We couldn't figure out what it was. It was to the end of the semester, but something that grows exclusively in the fridge, you pull it out within normal room temperature, which is about 20-22 degrees Celsius, doesn't grow. Okay. The example of genus is Psychrobacter genus. Now, psychrotrophs are interesting microbes. They have optimal growth temperature above room temperature, but they can slowly grow at the temperatures around 4 degrees Celsius. Where in your house you can find the temperature around 4 degrees Celsius? (40 degrees Fahrenheit? Where? Fridge, yeah, in the fridge. So these microbes are often responsible for food spoilage. It's actually a big problem for the food industry, right? Because things like fish, meat, milk products, dairy products, they stored in the refrigerators. Okay, generally like Bacillus or Pseudomonas contribute a lot to the food spoilage. So psychrotrophs, that their ability to grow in the fridge is why it is they contribute to the food spoilage. Mesophiles, you can see them right here, the green ones, grow optimally at the temperatures of the human body. And most of the pathogenic microbes belong to this group. It makes perfect sense, right? You can just start like Staphylococci, Streptococci, Lactobacilli, which comprise a huge portion of human microbiome. All those microbes have optimal temperature of growth around 30-35 degrees Celsius. Does that make sense? Now, thermophiles. The first thermophile that was isolated from the environment was Thermus aquaticus. This rather unremarkable bacteria was found in hot springs in Yellowstone National Park. It was used for research later. It was quite an important part of research. Now, for them, the optimal growth temperature varies between 45 and 80 degrees Celsius, which in Fahrenheit will be roughly about 110 to 180, I think, something like that, 180 Fahrenheit. Okay. And finally, extreme thermophiles like this archaea called Pyrococcus furiosus. I love the name. Of course, it's not red. It's just a coloring of the electron micrograph. The optimal temperature of growth is 100 degrees Celsius. Pretty much you have to boil the water. You have to boil the medium so the microbe can grow. It doesn't grow at the colder temperatures. It's too cold for it. You can find these organisms near the volcanic vents, the bottom of the ocean floor. So far we good? I'm a little anxious because I have a couple of surprises up my sleeve and I want to present them. Good surprises, don't be scared, good surprises. Good surprises. What else can influence growth? Anything in the environment, honestly. But we talked about oxygen, we talked about temperature, we talked about pH, salt, or taken broadly, concentration of the solutes in the medium. So Osmophiles. Osmophiles grow in the environments with a high concentration of solutes. For instance, fungus called Saccharomyces rousi grows at the water activity of 0.62. I understand your emotion, oh God, now we need to know about water activity as well. Not really. All you have to know about water activity, pure distilled water has low water activity of 1. The more solutes are in the water, the lower its activity. Does that make sense? Do you understand what I'm trying to say? When you start to make a solution, water activity decreases. Does that make sense? So this is pure water. Okay? This is highly concentrated something. Does that make sense? No? Jason, does that make sense or not? No, tell me, no, it doesn't. Explain it one more time. Okay, good. Because you kind of said, no, it doesn't make sense. Anyway, osmophiles. When we talk about osmophiles, we refer to any concentrated activity, any concentrated solution. Okay? Say you go outside and you collect blueberries. I don't know if you do it here. We used to do it every summer in Louisiana in July. Just go and collect tons of blueberries. It costs like nothing, $1 a pound if you collect it yourself. So collect blueberries, and if you leave them, what's going to happen to them? Like leave them on the table. They're going to rot. People, they're going to rot. They're going to be fungi growing all over. Okay? So how can you very easily preserve berries? Huh? You can freeze them, but it doesn't relate to the osmolality. But no, wait. It's a great example. You can freeze them. Nothing will grow there. Nothing. You can mix them with sugar. I mean, you can mix them with salt, but you won't be able to eat them. You can mix them with sugar. Actually, you can just take raw berries, mix them with sugar, put them in a clean cans, and they're gonna keep, it's gonna keep them from microbial contamination for quite a while, because that sugar in there, it creates such a concentrated environment. Okay, does that make sense? Very high osmolality environment. It prevents microbes from growing. Now, when we talk specifically about microbes that grow in the environment with high salt concentration, we call them halophiles. So essentially, all halophiles are osmophiles, but not the opposite. Does that make sense? All halophiles are essentially osmophiles, but not all osmophiles are halophiles. Halophile, we talk specifically about growing in the environment with high salt, but it doesn't have to be only salt. Does that make sense? There are some microbes that must grow in the high salt environment, like this fungus. You can see it, Volemia ichthyophaga. Grows in the environment with the concentration of salt of 1.5 molar. It is, to say the least, it's a lot. Can give you the exact numbers right off the bat, but it's something like 4 teaspoons per cup of water. It's really salty. Barophiles, microbes that grow at extreme pressures. This bacillus here was isolated from the surfaces on the Mariana Trench. The depth of Mariana Trench is 36,000 feet. Huh? Below sea level, yes. So it's a lot of pressure. I don't know what, 12,000 atmospheres? I don't know, 1,200? I mean, it's a lot, really. It's enormous pressure. So this bacteria grow at this pressure, but if you expose it to the normal, regular atmospheric pressure, it dies. Xerophiles grow in dry environments, okay, where water concentrations, water activity is extremely low. So essentially, you're going to find xerophiles in what environment on Earth? Deserts, yes. You're going to find deserts. Microbial life is everywhere. Now, before we move to my favorite microbe, what you have to know: temperature, the 5 types: psychrophiles, psychotrophs, mesophiles, thermophiles, extreme thermophiles. Please do not worry. You will not have a question if the microbe grows at 15 degrees Celsius, what it is. And you have to select between psychrophiles or psychotrophs or mesophiles. No. We'll give you a description, something that which is responsible for the food spoilage. You think it's probably psychotrophs, okay? Which cannot survive at the room temperature. It's probably either extreme thermophile or psychrophile. Does that make sense? I make sure that questions are very distinctive. Good? And understand the idea. What is osmophile? What is halophile? Are they the same? As we just discussed, one is the part of another. What are xerophiles? What are barophiles? Now we're getting to my favorite microbe. It's polyextremophile, called Deinococcus radiodurans. The history of discovery of that microbe is quite fascinating. And you see, it doesn't look really remarkable in terms of the appearance. Microbe, just a microbe. One day, engineers at the nuclear power plant were cleaning the cooling, how do you call it? Something like cooling tower. So pretty much water recirculates, it circulates around the nuclear reactor. So it is constantly, it circulates, but it is exposed to huge radiation, just huge, just unimaginable, okay? So what they were doing, they were kind of dumping water and flushing the system, maybe some residue there, something like that, okay? And I don't know why, but microbiologists wanted to sample that water. Of course, not hoping that they're going to find something. So they found this guy. Temperature of that water is, I think it's pressurized, it's like, in some points it's boiling water, okay? Constant radiation. It survives acidity, okay? I think it was sent on the space station. It was placed outside, brought in back, survived the vacuum, okay? The amount of radiation that it can survive is 1,000 times more than the amount that's sufficient to kill a human. It's acute, of course. It's not like constantly exposed, okay? So that is obviously the world's toughest microbe. No contest. Do you know what is the world's toughest eukaryote? Have you heard about water bears? These cute little creatures called water bears, tardigrades. This is not for the exam, this is for your information. Okay? They are multicellular eukaryotes. As you can imagine, they live in water. And I think they feed on bacteria. They were frozen. They can survive acute heating. They can survive radiation. I remember the dose, but pretty considerable dose of radiation to kind of finalize the toughness. They were brought to the space station and they were placed for a couple of hours outside in the open container. In a vacuum, cosmic rays, and freezing cold. By freezing, I do not mean winter in Ohio. I mean negative 270 Kelvin, negative 270 Celsius. It's freezing. They were brought back. They survived. You can decrease the water content of a tardigrade to about 30%. You can rehydrate it later. It will survive. So these are badass guys. We don't know how they do it. If we would, it would probably benefit us, but we have no idea what are the mechanisms. These guys are pretty cool. So that was not for the exam. Okay. So with this, we move to control of microbial growth. And there are two aspects, two places where we want to control the growth. One is surfaces, like that's what you use microquat for, right? To wipe surface from the bugs. Another in the humans, that's going to be the separate topic, antibacterial drugs. How can we classify methods of control? Different ways. One way, the level of cleanliness. Let's put it this way. Okay, so whether it's a sterilizing method or it's just disinfection or it's sanitization. Another, what do you use for cleaning? Is that a physical method, like heating or exposure to the radiation? Or it's a chemical method, like using microquat or bleach, right? Or whatever you're treating. Because obviously, you're going to use different methods, whether you work with a patient or you work with something inanimate, like a table or surgical instruments, right? So based on the, so this table shows you the two classifications at the same time. One is non-living tissue fomites, tables, surgical instruments, whatever is non-living, and another is living tissue. So how clean you can make the non-living tissue? Can you make it sterile? Yes, you can. This process is called sterilization. Sterilization means that object is completely devoid of any forms of microbes, including endospores. That is very important, including endospores. Remember, endospores are extremely resilient to the environmental challenges. Examples of sterilizing: when you put the wire loop in the flame, you sterilize it. Everything dies. Does that make sense? Okay. So it's going to be invasive. Those are going to be invasive tools. Surgical instruments, needles for injections. Can you sterilize the room? Turns out you can, but it's going to be badass treatment. There's a corporation in Mentor named, anyone knows what corporate? Steris, yes. They World Research and Development headquarters, actually in Mentor, and they make equipment that allows doctors to sterilize the room. Okay, but you devoid it from any signs of microorganisms. Second level is disinfection. So in disinfection, you significantly reduce or completely destroy all vegetative life forms, including viruses, which means endospores can remain on the surface. That makes sense. So you kill most of the microbes. For this is used a lot in clinical settings, of course. Okay, in the bathrooms. Remember we sampled the bathroom surfaces on Monday, and almost nothing grew, because disinfecting agents, probably chlorine, bleach, okay, they were used to clean the surfaces of urinals and toilets. Sanitization is the reduction of microbial load, not complete elimination, but reduction of microbial load. It doesn't even have to be by killing the microbes. It can be just mechanically removing the microbes, like washing dishes, right? That makes sense? So it is achieved, sanitization is achieved mainly using detergents. If you would look at those three protocols over here, then you notice that they have something in common. Look at the treatments. Look at the agents that are used. Chlorine, bleach, glutaraldehyde, phenol, autoclave, radiation. Are those agents friendly to humans? Not really. Chlorine, bleach, radiation is not something I would willingly expose myself to. So the approach to clean the inanimate surfaces is very different from the approach to clean living tissue. Protocols that are used in living tissue, we're going to talk about two: antisepsis and degerming. Antisepsis is a reduction of microbial load on the skin, okay, through the application of non-aggressive chemical. Okay, so essentially killing the microbes, by applying, say, isopropyl alcohol, which will destroy the membranes and denature the proteins, or applying chlorhexidine, which will destroy the membranes, iodine, okay, which will oxidize proteins and will denature them as well. That makes sense? So we're not only removing the microbes, we're killing them. We're not completely eliminating them. Now, degerming is a mechanical removal of microbes in the skin or tissue surface, which reduces the number of microorganisms. Hand washing. In fact, even if you wash your hands without soap, you're still gonna degerm your hands, because you will slow off the superficial layer of the skin, and some microbes will leave the skin together with the cells. Does that make sense? So you have to understand the difference between living tissue versus inanimate objects, and know these 5 protocols. So if I ask you, do we do sterilization on the patient? You say, no, don't do sterilization on the patient. On the live patient, at least. Okay. That makes sense. Here come, surprise, biological safety levels. So BSL here stands for biological safety levels. There are 4 of them, 1 through 4. 1 is the least restrictive. What essentially these levels mean, it's a containment. Okay? Containment of the microorganism that you work with. BSL-1 is practically no containment. We work in BSL-1 environment. We do not contain pathogen. All we do is we dispose of the microbes in the biohazard. That makes sense. It means that microbes that we work with and techniques that we use, they present very little risk to us, to the environment, to anybody. They're not extremely pathogenic. there is very little risk of transmission if you utilize the proper technique. Again, if you utilize the... Nobody can prevent people from doing stupid things. Okay? If you decide to leak the plate with Pseudomonas aeruginosa, I cannot stop you from doing that. It's your decision. Does that make sense? So if you follow proper handling instructions and you utilize proper technique, BSL-1 is enough. Things like E. coli, Serratia marcescens, Bacillus subtilis, those are BSL-1 pathogens. BSL-2 is used when you work with microbes that are indigenous. What does that mean, indigenous? Yeah. So we work with something that can be found, say, in the United States, in that region of the United States, right? They do not cause severe disease. They may cause the disease, but usually it's not extremely severe. Moderate risk. Example of BSL-2, influenza, rhinoviruses. Those are BSL-2 pathogens. What does that mean, BSL-2? Do you need the gown or the mask? In BSL-2 usually not. BSL-2 plus, you may need the mask. So transmission isn't easy. BSL-2 pathogens are handled in the hoods. Almost like, not quite, well, you see the hood there, but it's a chemical hood. Biosafety hoods have different... No. Oh, you're talking about the isolation. That's isolation chamber. That's hood. It has a sash. So you pull up the sash, you stick your hands inside, you have gloves, of course, and there's an airflow that strictly separates you and the sample. So you cannot contaminate the sample, and the sample cannot contaminate you. Does that make sense? If you would go to practically any microbiology department in any college, you will find a lot of biological safety hoods, and it's BSL-2. Most people work with different sorts of BSL-2 pathogens. Now, what is BSL-3? In this case, microbes can be exotic or indigenous. For instance, we don't have yellow fever here in the United States. It's a BSL-3 pathogen. It can cause serious or potentially lethal disease, yellow fever, but not through the respiratory transmission. Okay? It's very serious disease. We also have a vaccine, but it's exotic. So we handle it in BSL-3. Does that make sense? We do have vaccine. It is not easily transmittable through the aerosol, so we're good. Examples of BSL-3 in the US will be West Nile virus, yellow fever. I'm not sure about dengue. It's probably going to be 3+. Okay. Now BSL-4, microbes that are extremely dangerous. We do not have vaccine against them. Most of them are exotic. So for instance, Ebola virus, Marburg virus, smallpox. Smallpox is eliminated from the face of the planet. We still have stocks of smallpox in 2 places in the world. One in CDC in Atlanta, one is Koltsovo in Novosibirsk in Russia. So we still keep stocks of smallpox virus. But there is no infection going on in the world ever, anywhere now. So these microbes are handled with a BSL-4. Okay. We do have vaccine against smallpox, but the thing is, we do not vaccinate on a regular basis, and since it's eradicated from the environment, we're really concerned about escape. That's why we handle it in BSL-4. Plague, I think, is BSL-3, so it's not that bad. We have drugs, really effective antibiotics. Tularemia is also BSL-3 pathogen, I know that. My former colleague It's going to work with the tellurimium BSL-3 environment. Now, before we move on, I told you I have a couple of